Sorry, 721. This is the West Side Morning Report. I'm Dave Bourne. Thanks for joining us today. We have more news, traffic, and weather headed your way at the bottom of the hour. But right now, it's kind of an important subject. A Supreme Court decision has come down, and it deals with sleep apnea. And joining me now is Dr. Keith Valachi. He is with the Dental Sleep Apnea and TMJ Clinic. And good morning, Doctor.
Hey, good morning, Dave. Thanks for having me on.
You bet. So tell me a little bit about this Supreme Court decision that came down regarding trucking companies and sleep apnea.
Sure. So my understanding is that some time ago, the Crete Trucking Company required that their drivers would have to be tested for sleep apnea if they had a BMI, which is body mass index, of over 35. And that puts those drivers in the morbidly obese category. So not just obese, but morbidly obese. One of their drivers sued the carrier in 2013 and said that the screening program violated the company's drivers' rights. The Ninth Circuit Court of Appeals issued a decision last October upholding Crete's policy, and they called it legitimate and non-discriminatory. So that was forwarded to the Supreme Court, which actually declined to take the case, and that meant that the lower court ruling stood. So that's kind of where that all started. So at this point, the trucking company is allowed to test their drivers for sleep apnea with that parameter.
Well, it is kind of a dangerous thing. I mean, people die from sleep apnea and not know it because they never went to the doctor and said, "Hey, I've been really groggy and sleepy. I'm having trouble sleeping. I keep waking myself up, and my loved one is telling me I'm really loud snoring, and they don't take care of it."
That's right. A lot of that's true. The one distinction is that people don't tend to die of sleep apnea per se.
But it can happen.
But they tend to die of the medical effects that tend to accompany sleep apnea. So people with sleep apnea tend to have a higher incidence of high blood pressure, diabetes, depression, and I think the statistic is 350% more likely to die of sudden death, which typically is going to be a stroke or a heart attack.
And so what are the next steps for this, not only the trucking company, but also people that think they might be having sleep apnea?
Well, as far as the trucking companies or even the transportation industry in general, I think time is going to tell. At this point, my understanding is that there are no federal laws that require any kind of testing for any industry or group, but they have, I think, as of last year, started taking public comments on the possibility of requiring sleep apnea testing for transportation employees, and that would be commercial truck drivers, train drivers. There have been a few train accidents in the news here in the last couple of years where the drivers were found to have sleep apnea. Even airline pilots, the FAA doesn't even have any actual rules for testing pilots. There's just guidelines at this point. So, it's kind of a public safety issue. It was framed as a public safety versus a personal freedom issue, and, depending on how you feel about that, the way that's framed, you can take a stand on that issue one way or the other.
Sure.
From a personal health standpoint, though, certainly I think it's very important that anybody who has the risk factors for having sleep apnea, anybody who's overweight or obese, has some of the common medical co-conditions, high blood pressure, diabetes, previous history of heart trouble. If they snore loudly, or if they've had a spouse or bed partner tell them, "Hey, I see you stop breathing at night," really important to get tested because it can be a condition that can kill you. It can shorten your life. It can certainly make your life a lot less enjoyable because you're a lot of times feeling dragged out during the day and can't think straight, and has a lot of effects like that as well.
Yeah, I'm right there. I was diagnosed with sleep apnea. I got a machine, and boy, do I sleep a lot better now.
Well, that's great. And I was diagnosed with sleep apnea myself, too, so you're in good company there. And I'm being treated, actually, with the other method, which is with oral appliance therapy.
Oh, nice.
So,
and do you make those?
Yeah, well, I don't actually make them. We have labs make them. But, yeah, here at the Dental Sleep Apnea Clinic, we treat patients who either can't use CPAP or patients who have milder conditions who would prefer to use an oral appliance. And I work with a lot of sleep physicians. There's a lot of excellent sleep physicians here in the Portland area. And we work especially in collaboration with Oregon Sleep Specialists. And Oregon Sleep Specialists provide sleep testing and CPAP equipment for patients. So we're able to kind of cover all the bases there.
Oh, that's a great thing. And boy, you could be helping a lot of people for sure. So with this Supreme Court decision,
yes.
This would also affect bus drivers, school bus drivers, MAX drivers, anybody that is dealing with the public that's driving or flying, like you said. They all should be tested for that, correct?
Well, I think so.
I think so.
You know, when you look at some kind of statistics, and first of all, if you understand that sleep apnea, as I mentioned, can mean that you're operating your life in a kind of a drowsy state. We know that people with untreated sleep apnea, for example, have about a 250% increased risk of a motor vehicle accident. Statistically, I understand if you're awake for 18 hours, you are driving drowsy, and it's similar to driving with a blood alcohol content of 0.05. If you're awake for 24 hours, that goes up to approximately blood alcohol content of 0.10. And for commercial drivers across the country, if you are found to have a blood alcohol content of 0.04 or more, you can get a DUI.
Oh, wow. Dr. Keith Valachi, he is with the Dental Sleep Apnea and TMJ Clinic in Beaverton. What's your phone number for people to make an appointment to see you?
Oh, thanks, Dave. Phone number is 971-271-7478.
Thank you so much for the information.
Hey, it was really good talking to you. Thanks so much, Dave.
You bet. Have a great day. It is 7:28. This is the West Side Morning Report. We have more news, traffic, and weather coming your way in 2 minutes here on KUIK.